Hey everybody, welcome. For those who don't know me, I'm Dr. Amy Myers. I'm a functional medicine doctor and I am the medical director of Austin Ultra Health. But also I am the author of the New York Times best-selling books, The Autoimmune Solution and The Thyroid Connection. So today I'm super excited for you to be joining me because we're going to be talking about ways to prevent and reverse autoimmune diseases. But today I am celebrating because my first baby, as you might know, I've had a few since then, but my first baby, the Autoimmune Solution, is being released in paperback today. So you can go and purchase it on Amazon or anywhere books are sold. You can go get the paperback. So I know there have been a lot of people. We already had over 1,000 pre-orders for this without us even announcing anything. So there have been a lot of people waiting for this to come out. You know, when books are published, they're published as hardback books typically, and typically a year later they go into paperback. But this book was so successful and selling so many copies, they waited till they had sold over 100,000 copies in the hardback before releasing it into paperback. So it should have come out a year and a half ago in paperback, but it is today that it is being released. So since then, I've also had my other baby, the Thyroid Connection, and my real baby, baby L, Elizabeth Grace. So I'll be telling you a little bit more about her and how I'm helping her to prevent autoimmunity as well. So the Autoimmune Solution book has been translated into over 10 different languages, foreign languages, and as I mentioned, has sold over 100,000 copies. So, and of course has helped tens of thousands of people reverse and prevent autoimmunity. So, I am so passionate about autoimmunity, for those of you who don't know me, because I myself had autoimmunity. I was diagnosed with Graves' disease my second year of medical school. And of course my story is in both books, so you can pick up a copy and read it there, so I won't go into that now. But to suffice it to say, conventional medicine failed me, and I am on a mission to not have it fail you too. So that's why for the past decade, I have been spending so much time working with patients, creating protocols like the one that I did in the Autoimmune Solution book in order to help people prevent and reverse autoimmunity. And that's what we're going to be talking about today. I'm going to be sharing 5 practical everyday tips that I use that is in the protocol for the Autoimmune Solution. So I'm also going to be sharing some success stories with you at the end of all this, and of course answering your questions. And as I mentioned, I'm also going to be sharing personally how I'm helping my own child hopefully prevent ever having an autoimmune disease. So I'm going to roll that into the 5 practical tips that we're doing. And if you stay tuned, if you're interested, she'll probably make a guest appearance so she can say hi to you guys. All right, so what I want to announce before I get into the 5 practical steps is that if you order or purchase your copy in paperback of the Autoimmune Solution, you can just press a button on Amazon. For those of you who are tuning in from around the world, remember Book Dispensary has the book in paperback as well with free shipping anywhere in the world. So if you purchase a copy of this book today through Saturday at midnight Central Standard Time, you're going to get the companion shopping list that tell you exactly what to buy for the 28-day program. And you're going to get a reintroduction ebook, so it tells you exactly how to reintroduce all the foods after the 30-day meal plan. The Thyroid Connection has a 28-day meal plan. So how to reintroduce the foods after your 30 days on the program. You're also going to get 5 talks from my Autoimmune Summit that was viewed by over 100,000 people worldwide. It was a huge success. And the top 5 videos, the most watched, most popular videos, you'll get those for free, as well as if you choose to purchase my Autoimmune Solution program, which has helped tens of thousands of people as well reverse their autoimmune disease, you'll get $100 off that program. And that includes 6 weeks of video courses walking you through. You know, when I created the Autoimmune Solution book, a lot of people said, obviously it was super helpful, but some people needed more hand-holding. So that's why I created the video course. So it's 6 weeks of videos, 25 downloadable tools, checklists, guides, a completely different 30-day meal plan. So even if you're looking for more recipes, you can use it just for that. And of course, guided support during the whole 6 weeks. So let's get started. So for those of you who are new to autoimmunity and maybe don't know what it is, I'm going to review that super quickly, and then we're going to dive into the 5 strategies to help you prevent and reverse autoimmunity. Real quick before I do that, if anybody's on, I'm going to pull up and say hello to a couple of people. If people want to tell me hello, and if people want to tell me hello and tell me where they're from. If not, maybe Javier can call out a couple names because I can't see them. And also like and share this, please. So let's see, is there, let's see, let me see if I can see. There's already a number of comments. So, oh, I can hear myself. So let me turn that off. So we have Kelsey from Albuquerque, Ginger from Minnesota, Kay from Castle Rock, Colorado, Jamie from Tucson, so Elaine from South Florida, and Brenda from Nashville. So it looks like lots of people from all over tuning in. Super happy to have you here. So like and share this with anybody who you think needs help with autoimmunity. So real quickly, what is autoimmunity? Well, at its foundation, it means that your body is attacking itself. It's viewing it as foreign. So our immune system is there to protect us every day from all these foreign invaders, bacteria, viruses, parasites. But when it gets the signals wrong, it can actually attack our own body. So what are some signs and symptoms? Well, one of the reasons why they're so hard to diagnose, and it can take 5 to 6 years of antibodies coming out before somebody getting diagnosed, and people going to 6 to 10 doctors before getting diagnosed. And that's because the symptoms can be so vague and they can come and go. And autoimmunity can attack virtually any area of your body. So it can be things like swelling, joint pain, fatigue. Your hair might be falling out. You could have muscle weakness. You could have tremors. You could have weight gain. You could have weight loss. You could have skin issues, memory issues, brain fog. So there are over 100 different autoimmune diseases. And again, they can affect any organ in your body. So the symptoms can just be so vague. All right, so in my book, The Autoimmune Solution, I talk about something called an autoimmune spectrum. As I mentioned, these symptoms can come and go for many years before they eventually come out in full first autoimmune disease. So I think of it as a spectrum, somebody who has absolutely no symptoms and no inflammation, to people who begin to have inflammation, whether that's acne, rosacea, eczema, allergies, all the way up to beginning to have those, irritable bowel coming and going, to then these signs and symptoms that stick that eventually get diagnosed as an autoimmune disease. So the good news about this spectrum is, and I talk about this in the book, of course, is that even if you're all the way up on the spectrum, diagnosed with autoimmunity, you can get down that spectrum. I see it day in and day out. Again, this book has helped literally, tens, if not hundreds of thousands of people around the world help reverse their autoimmune condition. So you can get back down that spectrum. And people who are creeping up that spectrum, you can get down before you even get there. So you can prevent autoimmunity as well. So what we know through identical twin studies on autoimmune diseases is that 25% of it's genetic and 75% is the environment. So that's huge. You have 75% is in your control, and that's what I'm going to talk to you about today. 5 factors that are completely in your control that you can do something about in order to reverse your autoimmunity and to prevent autoimmunity. So the first one that I want to talk to you about is healing your gut. Now, many of you have heard me talk about about leaky gut, so I'm not going to spend a ton of time here talking about that because, of course, I go into all of this in the book and I have tons of information on my website about that. But we know through research, mostly from Alessio Fasano at Harvard, who's done most of the research on leaky gut and autoimmunity, that leaky gut needs to be there in order to get an autoimmune disease. So the first step in preventing it or reversing it is healing that leaky gut. So what are some take-home things that you can do right away? I want you to do things like bone broth. We've heard about all the good nutrients in bone broth, and what that does is that actually helps you heal up and seal that leaky gut. And I actually forgot to grab my bottle right down there, so I'm going to ask my hubby to do that. We have an exciting announcement. The other thing you can do if you don't want to make bone broth or you don't have time is to get collagen. So collagen, that's why you're drinking bone broth, to get that gut healing collagen that can also help with hair, skin, and nails. but really helping to heal your gut. And we don't have this out yet, but I'm super excited to announce that in the coming weeks, the next couple of weeks, I have formulated my own collagen powder. It's grass-fed, pasture-raised cows. So, of course, non-GMO and gluten, dairy-free, all that good stuff. So, I was having a hard time finding a really high-quality product, so I created my own. So, be on the lookout for that. But bone broth and collagen are excellent things you want to be doing to help heal your gut. Also, I want you to be taking a good quality, high-count probiotic with multiple strains in it. And, of course, healing any infections that you may have in your gut. So I talk a lot about candida and I talk a lot about small intestinal bacterial overgrowth, or SIBO. You can take quizzes. They're in the book. I have quizzes for both of those in the book that you can see if you have them, and then supplement recommendations and natural ways to heal both of these. But it's very important that we've got to get rid of these infections in order to heal our gut. So candida, you'll want to go on a low candida diet. Again, that's all in the book. And take supplements like caprylic acid that comes from coconut oil, and something called candisol that helps. It's an enzyme that helps break down the yeast cell wall. And then for small bowel bacterial overgrowth, I recommend something called Microbe Clear if you can't take the prescription medication, if you're not seeing a functional medicine doctor. So all that's available on my website if you're interested in doing any of that. And what I wanted to talk about is my daughter, Elle. So what we've done for her to help prevent having a leaky gut. So many of you may know she was born by C-section. She's adopted. I was in the room during the C-section, but I was able to talk to her doctor about doing something called seeding. So any of you out there who are pregnant or needing to have a C-section, this is really important. So it's taking all the good bacteria from the birth canal and putting it on the baby as soon as they're born. So when a baby comes through the birth canal, they take a big gulp and they get all those good bacteria. It's how they seed their gut and how they get their microbiome in the first place. So if you're a C-section baby, you're going to miss that. So what you do, and we're going to have articles on this soon, is put some sterile gauze up there in the birth canal prior to birth for about an hour. And once they're born, within the first 2 minutes, taking about 15 seconds to wipe down, getting it in their mouth, getting it in their eyes, getting it all over their body. And the studies are showing that babies born that way and who are seeded versus babies born naturally through the birth canal, their microbiomes are very similar years down the line. So it's super exciting, and I was thrilled that her doctor was willing to do that for her. And we found a surrogate who's been willing to let us buy breast milk from her, fully screened for autoimmune disease, no antibodies, and I'll talk about something exciting that she's doing. But so Elle is being breastfed. She's been exclusively breastfed, which is super exciting, and I'll have more articles about that and what to do if you can't breastfeed. And I'm giving her daily probiotics. So we'll have that back on our store in the coming week as well, week or two, the infant probiotics. So infants below the age of 2 need different probiotics than what the rest of us are taking. They have very specific strains to the microbiome of your baby. So that's what she's doing in her bottle every day. All right, so that's step number 1, is to heal your gut. Step number 2 is to optimize your diet. So one of the first steps in healing your gut is changing your diet and making sure you're not getting GMO and all these, frankenfoods that are creating a disturbance of your gut microbiome and creating leaky gut. So one of the biggest and first steps that you can do is to ditch the gluten. I write all about this in the book as well, something called molecular mimicry. I'm not going to get in that today, but just to say that gluten can look very similar to many of the tissues in our own body. So when we have a leaky gut and the gluten gets through, our body can go attack the gluten and inadvertently attack one of your other organs, like your thyroid, for example. So definitely want you to ditch gluten. And then this other process of molecular mimicry can happen with dairy as well, specifically casein. I'm going to take a minute to pop in. Of course, Robert's on. Hey, Robert, you're always here. Happy to see you. We have, let's see, who else we have? We have Catherine. We have Amanda. We have, that looks like some other tardigrade tough. Not sure what that is. But anyway, that's who's showing up. So, hey, everybody. So gluten and dairy, definitely want to ditch those foods. So I will not be introducing those in Elle's diet. And then for many of you with autoimmunity, I want you to ditch grains and legumes as well, at least for the 30 days, because those have lectins in them and prolamines that can irritate your gut lining and can cause leaky gut for a lot of people. Not to mention, if you have things like SIBO and Candida, they can feed those infections. So we'll want to get those out for 30 days. Remember, when you get the book, the paperback today, we have a food reintroduction guide that you'll get for free. So that will explain how to add all these foods back in and see, can you tolerate grains and legumes every day, not every day, once a month. Remember, if you don't know, I was a vegetarian for 27 years, eating brown rice and black beans and tofu almost every single day for 27 years. So I don't really eat those things too often anymore. All right, so you definitely ditch in the grains and legumes, gluten for sure, and dairy as well. So Elle, like I mentioned, she's breastfed, and her surrogate, lucky me, is not eating gluten. I was like, couldn't even believe how just amazingly quickly and easily that all fell into place. She was already gluten-free. So I was really thrilled about that. Don't plan on giving her any gluten, and then optimizing her diet. Of course, breast milk is the optimal food for her to be having right now, and we have a commitment that she'll be doing that for at least 6 months. Ideally, we do it for a year, but again, I'm not able to breastfeed, so I'm not, 100% how that's going to go. And she's also, what I've added into her formula is some additional vitamin D. So we have additional vitamin D. We have the drops on my website that I've been using, and liquid fish oils, which are also available on my website as well. So those are the things that are going into her breast milk in addition to the regular breast milk. All right, so now we have talked about healing your gut, optimizing your diet, and I want you to tame the toxins. So the easiest way to tame the toxins is to look at what the air you're breathing, the water you're using, and the food you're eating. How do toxins get in? We breathe them in, we put them on our skin, and we ingest them in. So let's just quickly walk through all of those. So you want to be thinking about the water you're drinking and the food you're eating. So hopefully on the plan, you'll already be eating, as best you can, organic foods. If you can't be eating organic foods, definitely looking at the Clean 13 and the Dirty Dozen to see where you want to try to get organic foods and which foods you really want to avoid. If you can do meats organic, that's really helpful because they are higher up on the food chain, and so they're getting vast majority of the toxins. So food, water. Most people think about filtered water for drinking, but many don't think about filtered water for showering. So you definitely want to make sure you have a shower filter on your shower, and we have one that has a wand that we can then put in the tub to fill up the tub. I personally use Sauna. My staff will put in a code if you want to get that as well, and put in Dr. Myers, and I think it's 30% off. But anyway, you want to get a filter of some sort, not only for drinking, but for bathing. People don't realize how much water you're absorbing when you're bathing and showering, also because the water is warm and it opens up the pores and more toxins can come in. And certain toxins actually vaporize in the steam and then you breathe them in. So got to be really careful about that. And then air, if you can, HEPA filters in your home. Of course, if you work for yourself or work for somebody that allows you to do that, that's optimal as well. And then thinking about other ways toxins are getting in, our beauty products, our cleaning products. We have some information on my website, lots of recipes about do-it-yourself, natural home cleaning products and body products. Super easy to make, save you money, save you toxins. So really look at that. I also carry a few on my website, brands that I approve of and really like. And then Dr. Bronner's is awesome. You can get that at Target now. You can get that on Thrive Market, Whole Foods. So great soap that can be used as a house cleaner, all kinds of stuff. That's what we're using to wash Elle with. Her first bath, even in the hospital. I brought my Dr. Bronner's soap with me, and her first bath in the bath at the hospital was not with Johnson & Johnson, but with good old Dr. Bronner's. So, and then ditching plastics. And of course, if you have any mercury fillings, and being aware of where mercury is in fish you're eating and in the air you're breathing. So those are the biggest places that are the biggest types of toxins that can get into our system, and the ones that we need to worry about with autoimmunity. And my book goes in and explains the mechanism of all those, but I'm sure you don't care about that in this moment. You just want to know what to do. So what have we done for L? Well, for L, first off, ditch the plastic. So you know how many people are using plastic baby bottles? No, we got glass baby bottles. So we love these. Don't get anything out of this, but the Jovi plastic bottles have a built-in, anti-colic, anti-gas. They're amazing. We love these bottles. There's only 3 pieces to them. The bottle, there's a middle insert thing, and this. So super easy to clean. Of course, there is some minimal plastic here, but what are you going to do? So glass bottles, it's really important with babies because you get that milk in there, and it has a lot of fat in it, and fat can pull out toxins out of plastics. And then most people heat up their baby bottles. We heat up our bottles, right? We have a little steamer that we heat up the bottles, and so then that leaches the toxins from the plastic into it, and then it gets absorbed by the milk. So very important, if you have a baby out there, please get plastic bottles if you can. I'm sorry?
Glass bottles.
I'm sorry, please get glass bottles. My husband is correcting me. Thank you, sweetheart. Please do not get plastic bottles. Please, if you can, get a glass bottle because you'll be heating that and there'll be fat in there. So you'll want to do that. She just had her 2-month visit. We chose to delay vaccinations. If you delay vaccinations even up to 2 years, they need a lot less vaccinations. And then we'll be selective about the ones that we give her. We're very fortunate. I'm at home. I'm standing at home in my office right now. And so I'm here, and we have some extra help during the day as well. So she's not being exposed to a lot of germs in daycare or things like that. So we have the ability to do that. Not everybody does, and sometimes there are requirements at daycares and things like that, but we've opted to delay some of those. So she hasn't gotten, hopefully, any additional mercury or aluminum or other things that can spike the immune system. We opted for an organic mattress for her and changing pad and a little co-sleeper, and where we can, organic clothes, but you can't always do that. But Target has some amazing things that you can get. They have a new brand, Cat and Jack, that has an organic line, and then Burt's Bees has some great clothes too. So where you can. I'll be honest with you. Here it is, total honesty, a little off track here. I started with the honest diapers. I've even thought about doing cloth. But when a baby has 15 to 25 diapers a day, have you seen those diapers with the little blue line? Well, they are a lifesaver. So the point of all of this is you got to pick and choose what works for you and what you can fit into your life and what you can handle. Changing 15 to 25 diapers a day, for the moment, we're opting for, they're actually the Costco diapers because they don't smell like powder. That powder fragrance smell was driving me insane. So anyway, that's where I'm not doing my best, but eventually we'll get back to the honest ones, or maybe even doing the cloth diapers. But right now we're doing the regular old diapers, but I'm making headway in all these other ways, hopefully trying to prevent autoimmunity for her. Okay. So, and then of course the shower filter, when we bathe her, we have the filtered water. All right. So now we have talked about, healing your gut, optimizing your diet, taming your toxins. And now I'm going to check in and see if we have anything. We have Rhonda. We have Heidi, who would like me to talk more about vaccines. That's a difficult topic. I'm going to steer clear of that one right now. Sarah, appreciating me for being genuine. That is what you will always get. True honesty from me. I am a real human, just like each and every one of you guys. Just trying to do my best in this world. So we have Misty, Rabia, Laurie. So glad y'all are all here. All right, so we're going to heal our infections is the other part of this. So in my book, I have a whole list of certain bacterial and viral infections that are very specific to certain autoimmune diseases. There's some broad categories like herpes and Epstein-Barr that have been implicated in a lot of different autoimmune diseases. But there are other ones like chlamydia pneumoniae that's very specific to MS. There is Yersinia that's very specific to Hashimotos and Graves. So you'd want to go to your doctor and get checked for these because they're in the literature and they are real. So you want to see if you match up, if you have an autoimmune disease that is listed in the book as being associated with a particular bacterial infection, and have your doctor check you for those and treat you for them, because I've had some astounding results, even using conventional antibiotics to heal people from these infections. That actually was the thing that really helped them with their autoimmunity. So very important that you check out that list in the book. Then we have relieving your stress. So it's very important. So backing up, I don't have any examples to say about L in that one. So I shouldn't have any infections that I'm aware of at this point. So I don't have anything to speak of, in regards to that. Relieving your stress. So whatever you need to do, what is the best stress relieving technique? Well, first of all, we can't get rid of our stress. We all have it. I have it coming at me every day, day in and out, trying to be a mom, trying to work, trying to, we got the time of the Facebook wrong today and everybody was getting a little heated and stressed. So hopefully y'all all got here in time. Really sorry about that. But stuff happens. It's life. So we just need to know how to deal with that stuff when it hits us, because we can't avoid it. So what do? Well, I just took a deep breath and thought, it's not the end of the world. Send out an email, and how can we prevent this in the future? But what the most important stress relieving technique is the one that you're going to do. So whatever appeals to you. For my hubby over there, it's playing golf. For me right now, it's smiling at my daughter. It's playing with my dog. So previously, it's been things like meditation or muse or my heart. The best stress relieving, so we were talking about 5 ways to reverse autoimmunity. And we talked about, how you need to heal your gut, how we need to optimize our diet, how we need to tame the toxins, heal your infections, and now we're on relieving stress. So in relieving stress, what you want to do, we can't avoid it, but what you want to do is try to find ways to just relieve your stress. So in relieving stress, you are going to find the one that works for you. Like I mentioned, my hubby loves golf. I love to look at my daughter now. And you might enjoy something else, but I was trying to say right over here is my sunlight and sauna, which is one of the things that I used to do before I had a baby, get in and relieve my stress. Now with a baby, it's a little hard to find time to get into the sauna when you're also working full time, but I'm doing my best. So whatever works for you is the most important thing. Something that's super fascinating, because I've been mentioning my daughter in every one of these ways to prevent and reverse autoimmunity, is I go to this very special type of trainer who deals with, who looks at muscles and how they work, and there are a lot of muscles that would shut down for me each time I would go. They were on my right-hand side. And the right-hand side is supposed to be the masculine side. And literally, I go 3 times a week, and between each visit, it would, whatever they would fix would shut down again, and they would fix it. I was gone for 3 weeks with my dad being sick and passing away. Then went to get L in Wisconsin, was gone for 3 weeks there. So I didn't go to the gym for 2 months, wasn't working out at all, totally thought I was going to come back and be a complete mess. And I got there and all my muscles were firing. And for the last 2 months since I've been home, they fired every single time. So the only thing that I can figure is that my sweet daughter Elle has balanced out the masculine and the feminine side for me and is providing me great stress relief, and I'm no longer having my muscles shut down. So whatever it is that works for you, maybe having a baby or adopting a baby or a dog, that can also be helpful. But anyway, the point is whatever works for you is what you need to do to relieve stress. So all of the principles that I've been talking about today have been tried and true. They've been researched. I've seen them clinically effective in my practice. I've gotten feedback from thousands of people around the world. Of course, tens of thousands of people have done the program, but not all of them have sent me feedback. But some incredible results, some that I actually want to share with you here in just 1 second. So these things are not, it's not woo-woo. This is tried and true. And most importantly, I want you to know these are things that you can do while, if you're on immunosuppressive drugs, while you work to get off of them. So often people come in and they're like, oh, do I stop taking all this stuff in order to do your program? No, this isn't in lieu of. Of course, if somebody comes in and they have MS and their medicine's working and they're able to walk, or they have rheumatoid arthritis and their pain has gone away, we don't get them off their meds. I don't get them off their meds the minute they walk in the door. No, we do the program. We heal the gut. We optimize their diet. We tame the toxins. We look at infections and we relieve their stress. And as they begin to feel better, that's when we begin to wean the medication. So this is not an either or. This is something you can be doing alongside your regular conventional, rheumatologist, endocrinologist,
GI doctor, whomever you're working with. It's great to have a functional medicine doctor on board, but if you don't have one of those, the book is there to support you, to help go through the program and help you wean from these medications. So let's get into some great feedback from two people who've done, is not even the program. These people just read the book. I had the benefit of actually meeting one of them after the fact, which was really incredible for me. So Kaylee was diagnosed with lupus, vasculitis, and rheumatoid arthritis at age 21. She was a hairdresser, and she had so much pain that she actually had to stop working as a hairdresser. She had a rash all over her face from literally her head down to her toes. She was embarrassed. She stopped wearing shorts. She wore clothes that fully covered herself because she was so embarrassed. She had spent, I think, something like $30,000 going to conventional doctors, in and out of hospitals, had recently been married, and so was just, having this life of in and out of doctors with her husband, not a blissful honeymoon period, and eventually saw my book somewhere, read it, and within 15 days, after $30,000, I think it was something like 12 or 15 doctors she had gone to, years of pain and suffering, 15 days, her symptoms had completely disappeared. Or they were beginning to disappear. At 30 days, they were completely gone. She eventually got back to working as a hairdresser, wearing shorts again, and most importantly, I have goosebumps, going on vacation with her husband. So completely amazing. Just by reading and following a program in a simple book. That is on sale as a paperback today. And you get over $150 in bonus material, which I'll go over in just a minute if you order it or purchase it today through Saturday. Gia is another one. She was diagnosed with lupus, and she was put on Plaquenil because her joint pains were so bad. She read the Autoimmune Solution, and she started the diet, the Myers Way, and within, I can't remember how many months because they don't have it written down for me, a couple of months, she was completely off her medication. All right, completely. It was within a year. It was like 6 months, completely off all her Plaquenil. But the most amazing thing was, within 18 months, she ran a 5K and she did a Spartan race. Now, I don't know about you guys if you've ever heard of a Spartan race, but these are these obstacle course things in the mud and climbing over stuff. I couldn't do one of those. So here's a woman who had debilitating lupus on an immunosuppressive drug, and within 18 months of getting off of the drugs, she did a Spartan race. Amazing. So again, these are real results from real people that you can have too, I hope, by simply following the program. So it's my wish for you. It is what I get up every day in order to do. Conventional medicine failed me, and it is my mission to not have it fail you too. I didn't have me back then, so I want to give this gift to all of you. So, real quickly, before we get into the questions, I'm going to review all the things that you get if you purchase the book in paperback between now and Saturday at midnight. And my hubby is going to walk out and go get our little bundle of joy so she can come in and say hi and make a guest appearance. All right? In case you don't want to stick around all the way till the end. So, if you purchase the Autoimmune Solution, which is a New York Times bestseller and has become available today in paperback, you can get it at any store. Of course, Amazon's always the easiest, but any store you want in paperback, go back to my website, enter in your receipt number, and you're going to get 4 weeks of the shopping list that are the companion to the book. So the book tells you all the recipes, exactly what to do for 30 days. But there's shopping lists that tell you exactly how many, breast of chicken and whatnot to buy every week. That was something people requested once we finished the book. Once the book came out, we didn't think about doing that. We got so many requests that we created it. We have a reintroduction ebook that you'll get how to reintroduce all those foods after you remove them from your diet. We have 5 talks from my Autoimmune Summit, which is still one of the most popular summits that's ever been done. So 5 of the top talks. Oh, it looks like my baby's sleeping. 5 of the top talks, and so those are free. And then if you wanted to dive even deeper and have more hand-holding, we offer the Autoimmune Solution online program that I created, also because it was the feedback that I got from you guys out there that it was something that you wanted. So it's a 6-week video program where I walk you through the book, essentially, There's 25 downloadable tools, checklists, guides. There's a whole nother 30-day meal plan if you just want more recipes or you want to continue on. And of course, there's guided support for 6 weeks and some supplement guides and recommendations. So before I jump into all of your questions, I am going to take a sip of water. And is she sound asleep? Oh, my baby's asleep, so I don't know if y'all still want to meet her being sound asleep. Hang on. You want to? Oh, hi. Hey, baby girl. Hi. I was talking about you. You gonna wake up for a minute? Come on, tell everybody hi. Say, I just had a delicious bottle out of my glass bottles of breast milk, so I'm a little sleepy. All right. Well, tell everybody hi. Say hi, everybody. All right. I love you. Love you, baby girl. And maybe if she's awake, she'll say hello again at the end. Okay, so let me dive into some questions here. First, before I do that, going to, 1 second, just, I don't know why my computer is freezing. Okay, so, alright, so, Monica wants to know, is it possible to heal from food sensitivities? That is a great question. So, I would say, yes. The answer to that is absolutely. So most food sensitivities are coming from the fact that you have a leaky gut and you're eating the food frequently. So you need to back off the food and heal your gut. Now, the caveat to that is if you have autoimmunity, I would not recommend that you eat gluten or casein, dairy really, but casein because of that molecular mimicry. So even if you could heal your gut from that, I would not recommend that you do it. But it is possible to heal from food sensitivities. So that's one of the things when I see people with tons of food sensitivities, allergy symptoms, it tells me they have a leaky gut. All right, Nancy. Okay. I just had a tooth removed, an old root canal got infected. I have to have another one out as well. What do you think about biological dental implants? Does Sjogren's cause tooth decay? If so, how can I prevent this? So that is another great question. So I didn't have time to cover biological dentistry and root canals, but I do that in the Autoimmune Solution. There's a whole appendix all about molds and root canals and biological dentistry. So I would recommend that it sounds like you're working with a biological dentist. You know, I have to defer to them. I'm not a dentist. We have one, a biological dentist, Stuart Nunley in Marble Falls, who I personally use and refer patients to, and I would trust him with my life. So he is who I usually defer to, but he typically does take root canals out, and if you don't need an implant, he won't put one, and if you do need one, he will do implants. So, and he'll definitely test you to make sure that anything he uses is biologically compatible with you and not creating a problem. So can Sjogren's cause tooth decay? Well, yes, in the sense that with Sjogren's, it's affecting your salivary glands and you have less saliva, and so less saliva is washing away bacteria, washing away the food you're eating. So yes, there is a correlation with having tooth decay and having Sjogren's. How can you prevent this? Follow the program in the book, and that should help you hopefully reverse your Sjogren's. Rhonda, how do you feel about infrared saunas? Well, you can see the corner right there. I have an infrared sauna, so I use them very frequently and love them. They're really great for detox and can be super helpful. So, okay. Is there something I can help you with? All right. So I don't know, maybe something's dying over there and my husband needs to do it. What causes histamine intolerance? Well, I have an article on that, and a number of things can cause it. There's certain genetics that can lead you to that, but leaky gut can do it. Small bowel bacterial overgrowth seems to be implicated in histamine intolerance. So I would advise you, there's an article that I have on my website, on my blog, that you can read. Angel, do you recommend the supplements to go with the Autoimmune Solution diet book? Yes. So there are no supplements that are required to do, the program. However, they're recommended. I mean, it's when somebody comes to my clinic, I'm typically using a fair amount of supplements. I mean, you've got in a bad situation, so we're trying to quickly get you out of the situation. Is it possible to heal without doing any of the supplements? Yes, it is possible. I would say if you have infections, you need to kill them with some of the supplements, but in general, it is possible to do the program without the supplements, but you'll probably have more benefit if you're able to use the supplements. And we do have a supplement guide on my website, because that was other feedback that I got. It was my first book, so I got lots of feedback. Most all of it positive, but certainly things that could have been improved. So the supplements seemed a little overwhelming to people, so we then created a supplement guide to be a companion to the book as well. So Jamie, is a woman able to breastfeed if she's taking thyroid hormones? Absolutely. So you don't need to be thinking of thyroid hormone as a medication. Think of it as exactly that, a hormone. Your body's no longer producing the hormone it needs. It's like, can you breastfeed if you're taking insulin? Of course you can. Absolutely. So it's replacing hormone that your body is missing. And so it's really important that you do, and that you're on the right optimal dose, so that you are producing the right amount of breast milk, and that you're not, if you're not producing breast milk, actually thyroid dysfunction or not having enough thyroid hormone would be something that I would think about. Anna, how do you know if you have Hashimotos? Well, the best way to know is to get tested for antibodies. So I talk about that, of course, in the Autoimmune Solution, and if you're questioning it, would definitely read my other book as well, The Thyroid Connection. So that really tells you all the labs that you need to get. But TPO antibodies, thyroid peroxidase antibodies, are typically what are positive in somebody with Hashimoto's. So the true definition of Hashimoto's is antibodies with thyroid dysfunction enough to the point that you need medication or supplemental thyroid hormone. So just by having antibodies, that's not truly the definition, but I would, say you're on your way to Hashimoto's, even if your thyroid labs look okay with those antibodies. Moto, I have Graves. Do both of your books address hyper, aka Graves? Absolutely. So I had Graves' disease myself, so I wouldn't leave us out. So if you want to get both books, that's awesome. If you can only get one book, then I would pick, in your particular case, I would pick The Thyroid Connection, because I have a very specific protocol in it for hyperthyroidism. Of course, the Autoimmune Solution is going to help as well, but it's more broad for all autoimmunity, and it's not as specific. So The Thyroid Connection is going to be the book that you'll want to pick up. Jody, do you recommend zinc and vitamin B12? Well, I think everybody should take a really high quality multivitamin, and in my multivitamin I have methylated B12, 1,000 micrograms, and zinc, I think it's about 30 milligrams. So, and for those of you who don't know, many of you do, because we've already sold, I think, 500 bottles today, but my multivitamin that I formulated, that we've been out of stock for about a month, is now back in stock. So you can head over there. So when I wrote The Thyroid Connection, I created a multivitamin to be a companion to that. Now that can be used for everybody, not just those with thyroid dysfunction, but again, people are feeling overwhelmed with the supplements from the Autoimmune Solution. So I tried to streamline it for The Thyroid Connection. So as long as you're getting in a really good high quality multivitamin, really good high quality one, then you shouldn't need to take extra of those, unless of course you have MTHFR, which is a different story. Sally, what do you recommend to treat reactivated Epstein-Barr? So I talk about that in the book, and I have some supplements, humic acid and lauric acid, and most importantly, healing your gut so that you can boost your immune system so that you can then fight these infections. That's really what I do. So following the program in the Autoimmune Solution will help. So Michaelina, are all autoimmune diseases equally capable of being healed? So, well, that's a multi-million-dollar question. I would say in theory, they're all able to be healed, depending on where you hit them. So, the longer somebody's had an autoimmune disease, potentially, the harder it is to heal. If somebody has done damage, say, to their thyroid or their pancreas, a vital organ, and it has been destroyed and they can't grow it back, we can still prevent more autoimmune diseases because you're 3 times more likely to get another, and we might be able to reduce the amount of insulin or thyroid meds that are needed for that. So, I mean, I have healed autoimmune diseases that have been going on for 20, 25 years. I can tell you ones that are tougher than others. So vitiligo can be difficult and very challenging, and alopecia universalis, which is where you lose all your hair everywhere. Those 2 have been probably the 2 most challenging ones that I've had, but I have had people reverse those. But I would say it's not as frequently as, say, lupus, rheumatoid arthritis, MS, Hashimotos, Crohn's, ulcerative colitis. I've had a lot more success with those. But I think the point is, if you do nothing, it's only going to get worse, and a fire is brewing, and you're setting yourself up for more autoimmune diseases. So there's nothing to be harmed by trying, and a lot to potentially be gained. At a minimum, there's healing your gut and preventing a second autoimmune disease, and at a maximum, there is getting your life back. So I think it's certainly worth a try. So, Sally, what symptoms do you feel low-dose naltrexone might help resolve besides lowering antibodies? Will it help with chronic pain? Well, Sally, you must not be on my newsletter, because I just read an article about that went out in my newsletter today. So, Sally, I would recommend that you sign up for my newsletter at my website, amymyersmd.com, in fact, /newsletter, and you can sign up there. You'll get 25 or 40, some amazing amount of gut healing recipes and a whole ebook, and it'll be great. Plus, you won't miss out on valuable information like this. So it has been purported to help with chronic pain, and I would advise you to read that blog that I just wrote. Okay, so I only have time for a few more here. Heidi, so this is a good question. I have an autoimmune disorder. What's the percent risk my daughter has in getting one? Well, the identical twin studies show only about 25% is inherited. Now, it's different for each autoimmune disease, and it's also one of those things that if you're the only one versus your grandmother had Hashimotos, your mom had Hashimotos, you have Hashimotos, well, I think the likelihood or the potential is higher than if you just have something and you're the only one in the family. And then it varies amongst autoimmune diseases. But in general, it's about, I'm not saying that she has 1/4 of a chance of getting it, but we realize that 25% is genetics and 75% is the environment. The good news is it's not too early to start. You can see me. I mentioned it, and again, the video disrupted, so we'll splice these all together and send it out. But definitely, if you're just joining now, go back and watch the first Facebook Live. But in every example where I'm telling you how to prevent and reverse autoimmunity, I've told you things that I'm already doing with my own daughter, who's only 2 months old. So it is not too early to start. And, I'm hoping that it has a large impact. So, Amy, do I cover the MTHFR and the Autoimmune Solution? I do. I don't go into huge detail about it, but I do definitely cover that in both the Autoimmune Solution and the Thyroid Connection. Craig, do you recommend cutting out nuts? Yes, Craig, I do. You're correct. I just didn't want to get into all the foods when I was going through optimizing your diet, but grains, legumes, nuts, and seeds, again, because of the prolamines in the shell that can be irritating to the gut. They don't have to be eliminated forever for everybody, but I want you, to get rid of them for 30 days and then see how you respond to them. Okay, so Michelena, can constant UTIs be from autoimmunity? It could. I mean, there's certain autoimmune conditions, certainly neurodegenerative ones like MS, that they do get chronic UTIs. I mean, so it's certainly something to be investigated, but there are also plenty of reasons why people can be getting chronic UTIs that are not related to autoimmunity. So certainly something to investigate. Michelle, what is the difference? So I'm going to answer 2 more questions here and then have a few additional things for you. So, Michelle, what is the difference between Hashimoto's and hypothyroidism? Well, for conventional medicine, there's no difference because Hashimoto's creates hypothyroidism. So they believe just put you on Synthroid and that's the end of the day or the end of the story. But the difference is regular hypothyroidism, could just be caused from nutritional deficiencies. I talk all about that in the Thyroid Connection. Can be caused by infections, can be caused by stress, can be caused by heavy metals. There are a lot of different things that can disrupt our thyroid function. So, but if you don't have autoimmune, that's a whole nother, or having autoimmune is a whole nother can of worms. It means you definitely have leaky gut. It means that you're 3 times more likely to get another autoimmune condition. To me, it puts you in a completely different category than just having regular hypothyroidism. So you definitely want to know, and you want to get those antibodies checked to know if you have it or not. So on the semi-surface or the super surface, they're the same. Your thyroid is low and not working optimally, but down deeper, it's much bigger if it's Hashimoto's. Okay, so Gina, what's the best way to detox from too much iodine supplementation? Stop taking it is the first thing to do, and give it time. You could do saunas, regular detoxification, glutathione. We have something called liver support, but really just stopping it from entering your body is the number one thing to do. So I talk about that in the thyroid connection, the iodine controversy. I do believe that everybody needs some minimal amounts of iodine, and I go all, into that about the reasons behind that. And I do have iodine in my thyroid or in the Myers Way supplement. However, these big mega dosages that some people are advocating are not things that I do, advocate. So before we part ways, I just wanted to see if our daughter is awake and remind you that if you get the Autoimmune Solution in paperback between now and Saturday Central Standard Time at midnight at any bookstore, go back to my website, put in your receipt. You're going to get 4 weeks of shopping lists that are a companion to the book. You're going to get the reintroduction recipe ebook. You're also going to get 5 talks from the Autoimmune Summit. And you'll also, if you're interested in purchasing the Autoimmune Solution program, then you will also get $100 off that. And that's a 6-week video program that I created as a companion to this, with 25 downloadable tools, checklists, and guides, and also support during the 6 weeks. So I think that that is it, unless you want to see my little baby girl smiling, because I think she's awake now. You can see her sweet, sweet smile. And she'll send you guys off to say, thanks for joining Mommy today on our Facebook Live. And please pick up a copy of the Autoimmune Solution in paperback. And please know that there's hope that you can prevent and you can reverse your autoimmune condition. All right, y'all take care. Have a great day. Thanks for tuning in. Please like and share this. And good to see you guys. I'll see you again soon. Thanks. Bye.